my name is Karyn. I'm a medical assistant. I've earned my diploma, which is a one-year certificate, and now I'm working on my second year, the associate's degree. But some days I'm wondering, is it worth all the time, the effort, the dealing with computers? What is the career landscape for medical assistants in this area? So I decided to talk to an expert about it, someone that has skill, knowledge, and experience in this area. After this interview, I'm encouraged by the information that I received. I talked with Mrs. Denise Heimbecker, who is office manager at Advanced Care for Women. She and her husband, Dr. Paul Heimbecker, moved here from St. Louis, Missouri, about 12 years ago with their 3 children. Dr. Heimbecker worked with an OB/GYN center here in town. After a few years of that, he decided he wanted to open his own solo practice. So that's where Mrs. Heimbecker came in. She has her education from a junior college in Florida in accounting. From that start, she now is office manager with Advanced Care for Women. She's in charge of all the finances, payroll, insurance claims, and making charges for deliveries and surgeries that the providers perform. Now the practice has grown to Dr. Heimbecker, another doctor, the nurse midwife, 2 medical assistants, and 5 women that work in the office and administrative areas. We discussed the fact that the 2 medical assistants that work there have each been there 7 or 8 years at least. They came straight from earning their diplomas at CCCC. They actually spent their student externship there at Advanced Care for Women. They came in with the skills, the knowledge, and the confidence to perform as the doctors wanted them to. So once they finished their diplomas, the doctors hired them and were able to teach them and train them to do the procedures the way they wanted done in that office. The medical assistants were easy to train and learn quickly. One of them did only earn her diploma. The other one went on to become certified. They were hired within 1 year of each other, so there's not a real big difference in their salary, according to Mrs. Heimbecker. But we did talk about the fact that in this area, there can be a big difference in salaries for medical assistants, depending on if you're certified, how much experience you have. We discovered that the pay range starts for a medical assistant that only has a diploma will probably earn only $10 to $13 an hour. And on the other end of that scale is a medical assistant who is certified, who has 3 or more years experience, making anywhere from $18 to $25 an hour. So you have a minimum salary, yearly salary of $20,800 for a starting out medical assistant, all the way to $52,000 for one that has experience and certification. There are no positions open right now at Advanced Care for Women for medical assistants, but we did talk about other positions that are available. For a medical assistant, we could work in the administrative part of an office, doing billing, scheduling, reception, insurance claims, referrals, and even patient education. Medical assistants can also work in the clinical area, which means they would be helping doctors with treatments and procedures, working in the lab doing blood draws, throat cultures, other tests, urinalysis, just assisting in any way that they can. There is no official network to help applicants find jobs in the area with other physicians. But Mrs. Heimbecker did tell me that there is a physician's liaison at Central Carolina Hospital who knows all the physicians who are hiring and what positions they're hiring for. But medical assistants are not confined or restricted to just working in physicians' offices. They can also work in dental offices, hospitals, home health, physical therapy, rehabilitation centers, insurance companies, urgent care, laboratories, and clinics. The advancements in medical technology, changes in HIPAA regulations, and the coding and way insurance forms are done is always changing in the medical field. This is always presenting new challenges, according to Ms. Heimbecker. The discussion I had with her encouraged me that there are many varied careers for medical assistants available in this area. Technology is always changing, so that will be a challenge. it looks like the schoolwork I'm doing and have done will prepare me, give me the skills, the things that employers are looking for. I guess it is worth it. My conclusion comes to doing my schoolwork, becoming a medical assistant, and later a certified medical assistant is going to be worth the hard work. Thank you.